Using gait belts is an essential element to a culture of safety in any healthcare organization. Gait belts provide a safe handle on patients when transferring from bed to chair, when transferring to stand to walk or ambulate. Falls are a leading cause of disability. And not only can there be physical harm, but also mental harm to the patient. That's the harm that doesn't get measured. Without using gait belts, you're not doing everything you can to keep patients and staff safe. It's low cost, and it is engaging every staff member every time they move a patient. For this application, we will demonstrate using the single patient use cotton web belt. Always place the belt over the clothing or patient's gown. Never apply the gait or transfer belt directly against the skin. With the Posey label facing outside, wrap the belt around the patient's waist. Pass the metal tip of the belt through the buckle over the teeth. Bring the tip of the belt across the front of the buckle. Slip it through the other side and adjust until it is snug, but not uncomfortable. You should be able to slip your open hand between the belt and the patient. Lay the strap flat across the buckle and tuck excess under the belt. Always verify proper closure before use. Always grasp the transfer belt from underneath while adhering to your facility's approved procedures. Mobility testing is really simple, and for professionals who are licensed, it's really a true assessment of the patient's ability to move. It has 3 elements: cognitive, strength, and balance. It begins with the patient lying supine in bed. First, ask the patient to turn side to side. If the patient turns side to side, they're obviously following directions, and it's telling you that their cognition is intact. The patient can use the handrails on the bed to roll side to side if necessary. Handrails are just a simple assistive device. The next step is to ask the patient to come to a seated position at the edge of the bed. If the patient is able to push up to a seated position and can sit firmly without wobbling, you know that the patient is demonstrating good trunk control. The next step is to make sure that the patient's feet are touching the floor. This is where we're going to test the quadriceps strength. Have the patient do a straight leg raise, starting with the right leg and holding the leg out for 5 seconds. Then test the left leg for 5 seconds. If the patient demonstrates fairly good quadriceps strength in both legs, the next step will be to have the patient stand. First, place the gait belt on the patient and have a walker ready. Have the patient push up from the bed to a full stand. Instruct the patient to report any signs of dizziness or lightheadedness. But remember, a gait belt is an assistive device to steady a patient and should not be used to lift the patient from the bed. Make sure that they stand for a full minute and make sure there's no dizziness or lightheadedness. The next step is the balance testing, and that's a single point stance, asking the patient to step forward and back 3 times. If everything goes well, you're able to walk the patient safely. If the patient's able to do all of these activities without loss of balance and under their full strength, they might even be independent. Any independent patient does not need a gait belt. Even with the best intentions, patients fall. Worse than a fall is a fall with injury. Healthcare organizations have a moral obligation to do everything possible to prevent harm. I'm Wendy Rennersgill, clinical nurse specialist, also certified in rehabilitation nursing and orthopedics. I've been a nurse for 31 years. What I've learned over the many years is that without a culture of gait belts, you are not doing everything you can to keep both patients and staff safe.